Good morning. I'm Berks County Commissioner Christian Leinbach, and I want to welcome you to the Commissioners Board meeting for January the 7th. I want at this time to recognize Mary Buren.
Public comment will be accepted through the Q&A function. Please include your first name, last name, and municipality. Any comments without name and municipality will not be considered. Each citizen can submit one comment. Comment length is dictated by limitations of the platform being used, Teams, Q&A, Facebook, or YouTube. The meeting comment period is limited to 30 minutes in total. Please be concise. Comments will be read during the meeting and should not be considered to be interactive dialogue with the commissioners. Any commissioner response to public comment will be done at the discretion of the commissioners.
Thank you, Mary. As always, we are broadcasting on BCTV, the Microsoft Teams live platform, as well as Facebook and YouTube Live. We will begin, as we always do, with a moment of silence, followed by a pledge. I want to encourage those that are people of prayer, as we are in the moment of silence, to please pray for our nation. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Before we continue our meeting, I would like to share a brief statement regarding the United States Capitol breach yesterday. There is no defense for the violent incursion on the United States Capitol that occurred yesterday, January 6th of 2021. The people that participated in this breach should be prosecuted to the full extent of the law. Their actions were an attempt to violate the constitutional process of a peaceful transition of power. There also can be no doubt that the president must be held responsible for his incendiary rhetoric that led up to this black mark on our American history. I am equally angered as I am saddened. As I watched news reports yesterday, I was appalled. The constitutional process of transition has been a peaceful process throughout our history, despite some extremely bitter presidential races and other national crises. Yesterday, the world watched as a symbol of freedom and liberty was overrun by a lawless mob. Today, my prayer to God is that once again, he would shine his grace and mercy on this nation. I don't know if either of my colleagues would like to make any comment, no obligation, but I want to recognize that if anyone would like to say anything.
Thank you, Commissioner Leinbach, and very thoughtful words that came from you. And no words can describe what occurred yesterday. Horrific, tragic. I mean, you say what it is, but the loss of life. It's incomprehensible to see what happened in our nation's capital. And again, as you remind everybody, peaceful transition is what we're about. We're the pride of the world with our democracy. And this is no way to grieve your government. This is no way to say you don't like an outcome or you don't like what's taking place. You do it in a proper, dignified manner. That's how things change here in our country, and even at the local level. we're all here to do the people's work, townships, boroughs, cities, counties, states, and yes, the federal government, to do the people's work. It's not always the outcome you expect or what you like to see, but sooner or later, these things are done, majority is done for the betterment and the improvement of our community and our state and national government. And under the backdrop of the continuing stress we face as a nation, with yesterday alone another 3,800 COVID-related deaths, and the devastation it is put on everyone's families, their friends, their loved ones, and to our business community and on down the line. So we've got big issues to deal with. We've got to put this aside. We have to move on, and we have to do what's right to get us back to where we are the pride of not just the world, but of ourselves and the pride we have as Americans. So I was embarrassed to be an American yesterday, and it's, you know, you look back on your life of 61 years and go, boy, and one of the newscasters said, you'll always remember where you were when you saw this. And you can go back to the Challenger disaster and 9/11, and now this is going to be one of these that 20, 30 years from now, people are going to say, where were you when this happened? And it'll be still emblazoned in your mind. So thank you so much for your comments about this, Commissioner Leinbach. And we've kind of joked about it, been very serious from time to time about how we work together so well as sides of different aisles. But we don't always get what we want or what we think our majority of people expect from us, but we work it out together. We do it together in a way that we understand why we're here. We're here for the people. So thank you, and God bless the United States of America.
Yeah, not on mute. Yeah, just also, Commissioner Leinbach, want to thank you for your words and echo your comments as well. This is not something that should have happened, much less here in our nation. It's something that has not happened before, and I'm hoping and praying that it's something that will not happen again. The transition has to be peaceful. There's a time for elections. We had our elections, and now it's time to move forward. Now, as a nation, we need to come together. We need to pray. The elections has passed. What has happened has happened. Now we have to look to the future. We have to come together. We have to work together to be able to move forward as a nation. Like Commissioner Barnhart said, you know, three of us, we have different political affiliations, but we're able to work together. We don't agree on everything. There's other things that we do agree on, but what we do agree on is that the three of us are here to serve our county and do the best that we can for the citizens of Berks County. And that's what every government official in every government office at every level has to do. You have to look at what you're doing is not for you, but for the betterment of the office that you serve, of the people that you serve, and whatever that governmental entity is, be it federal, state, local level. The job there is to be able to serve the people and help our nation, help our state, help our communities move forward. So I'm hoping that we can come together and again work together for the betterment of our nation, so we can continue to move our nation forward and not ever have this happen again. Thank you.
Thank you, Commissioner Rivera and Commissioner Barnhart. At this time, I want to recognize Brian Gottschall, our Director of the Berks County Department of Emergency Services, for the weekly COVID-19 update. Brian?
Good morning, Commissioners. Thank you for the opportunity to present this again this morning. We had a couple weeks of a break here with the holidays where we didn't provide a presentation, and therefore our slide deck this morning is going to be just a little bit different than it has been in other weeks, where we'd like to take a look at some things with a bit more retrospective glance because of the weeks that have gone by where we haven't looked at this, as well as some additional slides that we'd like to talk about and make aware or bring to the attention of the general public. So as we always start out with the PA early warning dashboard, this week I've added in just a glance back to what it looked like on 12 of 17. On the left-hand side there, you can see the actual values that were present in the last dashboard we looked at. And I really bring that to your attention because the up and down arrows are reflective of week to week. But having had a few weeks go by, I think it's worth to look back where we were 3 weeks ago when we last looked at this and see where those numbers are today. Very honestly, they again are very much all over the board for Pennsylvania wide with respect to case counts being down, hospitalizations being up, but ER visits being down. I continue to struggle with, does the dashboard really give you a good dashboard view of the problems that we have going on in our society? Hence the reason we drill into these components a little bit more in our weekly report. We look at our smoothed cases and testing, again, testing over a 7-day smooth period and cases over a 14-day smooth period. We use those periods of time because that's what DOH used for us with respect to how they asked us to look at stuff originally. One of the interesting things is that as we've gone forward here, we see that the chart is becoming a little bit confusing because our testing, which is looked at over effectively a week, has diminished and our cases have increased so dramatically that when we look at them over a 14-day period, we see the charts starting to cross over each other. And it is important to keep in mind that the case count is over a 2-week period and the testing is over a 1-week period, but the math kind of all adds up because we see that they're right on top of each other, and that is because our positivity has crossed the 50% realm. So, we're looking at cases in a 50% time frame of testing, and we see them crossing over on that other chart, and that's because our positivity is at a 50% number now. It's an astronomical number. When we were looking at this back in the middle of October and wringing our hands over a 20% positivity number, I honestly never imagined that we would see that number get to 50%. But as we are seeing nursing home testing go up again as we start to see outbreaks in our skilled nursing and assisted living facilities, we're getting all of those serial negative numbers being brought into that state dashboard number, which is keeping that artificially low. But this is our first test positivity, the reflection of what's really going on in our community at large. Over 50% of the tests being done are coming back positive. We also take a look at our COVID death slide, and again, just a reiteration, the red line on the bottom of the slide is the daily numbers, and because the cumulative number is so large, we have some difficulty seeing that. On the right-hand side of the slide, in recent days, we've had double-digit death days of 15 or 12 deaths in a single day, but those peaks that are representative of that 12 or 15 number are kind of lost in the bigger picture of the cumulative deaths. And I think that the most important aspect of this slide is the slope of this curve. We see back here in the beginning in April and May that slope was very much vertical, and then it became very much horizontal throughout the summer as our death count slowed, fortunately. But in recent months, we're starting to see that number get more vertical again, not to where it was back in the spring, but still we're tallying up deaths in Berks County, and that is unfortunate. Our hospital look, usually we do a 2-week look. I wanted to take a look at the period throughout where we didn't have a weekly report, and we see that the numbers at our hospitals do continue to grow, kind of fluctuating up and down with respect to ICU numbers and numbers on vents. However, our counts of people in the hospital with known or suspected COVID continues to go up and continues to have an impact on our healthcare community. I will tell you that because of working the emergency services, I know a lot of people who work in the hospital systems, and those But let's forget the walls of the hospital. Let's forget whether the waiting room is full. Let's forget whether there are beds available. Let's just talk about the people that work there. Those people are beat up. They are getting abused day after day after day with these high patient counts. And they need a break. We as a society, we as a community really need to recognize what we're doing to these folks and help them out. Our county comparative snapshot, when we look at other counties throughout Pennsylvania, again, if everything were equal, we would expect to see 9s in all of those places because we are 9th in the state in population. We see that our order by tests administered continues to drop at a very slow pace, while our case count kind of holds steady, again, by population per capita. And our deaths per capita all went down, have bumped up a little bit. We don't know where that's going to end up, but we hope that we're going to continue to see a downward trend. Again, I don't like this slide because it opens up some provincialism, because what is good for Berks County really means something is bad for other people in Pennsylvania. And the county lines are an invisible thing. They don't mean anything. We're all one big community, and we want this to get better for everybody, not better for us at the expense of others. So a couple other slides that I hope you'll indulge me with this week. I wanted to speak to some of the things that I hear from friends, family, acquaintances, whatever you want to say, about COVID, and in particular COVID-related deaths. And one of the big things that I hear is, yeah, people are dying, but it's not happening here in Pennsylvania. And really nothing could be farther from the truth. I apologize if on folks' phone screens or tablet screens this is small, but the darker the color, the larger the number of deaths per capita over the last 7 days. And what we can see here is that Pennsylvania is in the top 10 in the nation. With respect to deaths per capita, we're out there leading the pack, and that is not a good thing. The fact that people believe that, yeah, COVID's a problem, but it's not a problem here in PA is absolutely not true. We are seeing people die at a concerning rate in Pennsylvania. Another argument you hear commonly is it's really no worse than the flu. And I went back and pulled statistics for deaths attributed to influenza from 2010 through 2019. The 2020-2021 statistics are not assembled yet because we're in that influenza season. But over those 10 years that are shown, 359,000 people died in the United States from influenza. In 2020 alone, 356,000 people have died of COVID. So the deaths that are attributed to COVID in that 1 year exceed the deaths that are attributed to influenza in the 10 years prior. And in both of these cases, I think that some folks would argue, yeah, but we're calling things COVID deaths that we shouldn't be calling COVID deaths. And I will go on to acknowledge that there's been some concerning or confusing reports out there of things that were attributed as being COVID. And I would accept some skepticism from folks who believe that. And that brings us to the next slide of geez, everything's a COVID death. Well, okay, let's put that aside for a second and let's not talk about COVID deaths. Let's talk about deaths in general. And we looked at this slide back in the beginning of December where we talked about, let's not get focused on whether somebody died in a car accident or died of COVID or died of cancer or whatever the reason. Let's just look at the number of people dying. And back in the beginning of December, when we looked at this statistic, we saw that 11% more people had died than would be expected to die in the United States in that period of time. In those 4 weeks, that number has risen by 1%. We now see that 112% of the deaths that we would have expected to take place really have taken place. And in Pennsylvania, likewise, that statistic went up by 1% from 107% to 108%. And that's kind of hard to get your head around until you look at it in a graphic way. And we look at these deaths back from 2017 through to today. And we see that again, this is Pennsylvania now on the slide, not the United States. We see that year after year after year, our deaths in Pennsylvania are a very regular statistic. They rise and they fall very much with respect to the wintertime illness season. We see back in 2018, we had a week there where we peaked above the statistically expected maximum. That was because we had a really bad flu season in 2017, 2018. But then we get over here on the right hand of the side of the slide to 2020, and we see week after week after week of significant exceeding of that expected maximum. And there is no other reasonable explanation for that throughout that year other than COVID. We blew this up a little bit just now, taking that right-hand side of the chart and looking at it a little bit closer so you can really understand those impacts. You know, in Pennsylvania, seeing weeks where the number of people who died in that given week beyond what we should reasonably expect to have died is 800, 900, 1,000 people in the spring, and again now as we've gotten back into the wintertime season. We had a period of respite here in the summer that was great, where those numbers, you know, every death is a tragedy, but looking at the statistics in a very unemotional way, the numbers were somewhat lower and were looking very good, but we are well beyond that now, back into this very concerning period of excess deaths. No one I know died from it. I guess getting back into the emotional, I would ask, is this really where we are as a society? You know, if that is true, does that mean now that we don't believe it or we don't care about it? And if we are there, if you are there as a person and you truly don't know anyone that died from it, I would say you're pretty damn lucky. Me, I'm not so much that lucky. I have family members, I have friends who have died of COVID. And very much from a professional perspective, I would point out to the citizens of our county that 3 firefighter EMS providers in Berks County have died. The third one just a few days ago. This morning, that individual's body was transported from the hospital where he died to a funeral home, being honored by fellow firefighters and EMS providers during that procession. These are people who are serving our community, who are out there taking care of these other individuals who are sick and or dying from COVID, and 3 of them have had their lives lost to this disease now. It is real, and if you don't know somebody that died from it, count yourself lucky, but don't believe that that's any type of justification for thinking that there are not people being impacted day in and day out by this disease. Very much related to that is only old people die from it. Again, I have to ask the question on the first slide, is that really where we are as a society? Even if it really is only old people dying from it, don't we care about them? Don't we care that they would have another 6 months, another year, another Christmas with their family? The reality is that we need to be concerned about each and every one of these deaths, but the fact of the matter is only old people die from it is not true. These are the weekly death counts again by age group for Pennsylvania. And every space, if you will, the area under the red curve down to the gray lines that represent the deaths from 2015 to 2019 represent people in those age groups who have died from this disease. And yeah, we see the numbers over here in the 85 and older and the 75 to 84 categories. They're the big spaces. They're the largest numbers of people that are dying. But there are people in the 25 to 44, in the 45 to 64 category who are dying at a rate beyond what we should be expecting to see them die, and that is attributable to COVID. So what are you supposed to do about all of this? Do you close your business? Do you quit your job? Do you lock yourself in your bedroom? No. Please take reasonable and easy actions. You know, generally this discussion starts off with wear a mask, but I'm going to move that to the end because I want to talk about this in a way that is kind of from least controversial to most controversial. And the first one is practice good hygiene. Wash your hands. Try not to touch your face. Keep surfaces in your business or in your home clean, and avoid what is called the fomite spread of the illness, the virus being deposited on surfaces and then being picked up and brought back to your mouth, your nose. create a bubble around yourself. Just, I try to do this at the grocery store because it's easy to do. I get in and I get right up behind the person who's in line in front of me, and I want to get my groceries on the belt so I can get checked out. And then I take a breath and I go, whoa, hold on a second. Take a step back. You really can almost do everything like you do normally, but just take a step back. Just step away from the person you're talking to. Step back from the person that you're in line with. It's really pretty easy. Help the public health authorities. If you are reached out to by contact tracers, answer the call, answer their questions, work with them, try to help them to keep track of where the illness is spreading and help other people that may have been impacted. If you're so inclined, download the application from the PA Department of Health that helps to alert contact tracers and let you know if you've been, if I get COVID and you were that person that was in front of me in the grocery store and we were in line for a long time together, you would want to know about that. And that application will help the contact tracers give you a heads up. Wear a mask and wear it properly, even when you feel safe. I use a seatbelt analogy about this. Hopefully we are all using seatbelts regularly, and we don't just put the seatbelt on at the moment that we see somebody around us driving recklessly or when the road gets slippery. That would make the seatbelt pretty worthless. We wear it all the time, even when we feel safe, because we don't know when we might not be safe. And I think if we would apply that seatbelt analogy to wearing a mask, it would make things so much better. I'm very much libertarian in my leanings, and I believe in liberty. I believe in personal choice. I believe in reasonably being able to conduct my life in a way that is free of the bridles of government, except in the way that my actions affect others. And even with all of those personal opinions, I truly don't understand the people who think that being asked to wear a mask is some type of a political reign that is being placed upon them. It's so easy. It doesn't cost anything. It doesn't really affect the way you get to live your life. And it truly is helpful to the people around you that you're supposed to care about. And that takes us to the last point of sacrifice just a little bit personally. I had the worst holiday season of my life, as I'm sure many other people did, who tried to do the right thing and not congregate with friends and family. But I moved past it. Everybody that did this moved past it, and there's going to be another Christmas, there's going to be another Thanksgiving. And doing that, hopefully, I'd like to believe helped somebody. Maybe it wasn't me, maybe it wasn't my wife, maybe it wasn't my daughter, but hopefully it avoided the spread of this illness in our community for somebody. And the last thing I'd say about these actions that you can take is maybe you don't agree with all of them. Maybe you're not prepared to do all of them. Maybe you think one of them is an incursion on your liberty. Okay, then do some of them. Do one of them. Do whatever you're willing and able to do out of that list, because anything you do is a little bit of help beyond doing nothing at all. The last thing I want to mention in the report this week, and this was not in a slide or included in the presentation, literally because the news just came out this morning from Pennsylvania Department of Health, that the new variant of COVID that we've heard about presumably on the news that started in UK and South Africa and appears to be much more highly transmissible than what we've seen before, has been identified for the first time today in Pennsylvania. A case has been discovered in Dauphin County. If that one case is in Dauphin County, it means that there's many other cases that have not yet been discovered. And what that sums up to is the new variant is in Pennsylvania. It is in our community. And I would hope that people, I find the news reports about this very confusing, and I've had discussions with folks in my own family in talking about this who say, well, the news says that the vaccine still works against it and it's not any more deadly than the other kinds of COVID that we've seen. It's just more transmissible. This is a math problem, folks. More transmissible equals more deadly, because even if the level of mortality from the disease remains the same, if 50% more people get the disease, more people die. And again, it's very harsh, it's very ugly terms, but the reality is, if you asked me, Would you prefer that the disease is 50% more deadly or 50% more transmissible? I'd pick 50% more deadly, because you're still going to get those extra deaths from the additional transmissibility and just more people statistically catching the disease. But then from the transmissibility issue, you're going to have all of the compounding factors, like impacts to our healthcare system, like impacts to our employee workforce, and all of those types of things. This is very serious, and having a new strain of the disease that is more easy for people to catch, even beyond the strains that were with us prior to this, is something that should make all of us be interested in doubling down on these mitigation actions that we're being asked to take. So, commissioners, thank you. I apologize that went a little longer than we usually try to go, but we had a few weeks we had to catch up on, and we also had a few new issues we had to catch up on.
Thank you very much, Brian. I want to recognize Commissioner Kevin Barnhart.
Brian, always extremely well done, and you've done a lot of homework, and I think the community should applaud you for your efforts. These graphs are really telling. I think it's an appropriate time to update everyone on Cook County Wellness's efforts, if you might, instead of waiting till my report. So total since June 8th, 5,771 contact tracing, probably another 1,000 that received information. And at this point, this week, there was an additional 115 new contacts, and the success rate was 72%. And as I've said many times in the past few weeks and past months, that number continues to decline. When we started contact tracing back in June, we were at probably 80% reception. Now we're dropping down to 72%. Echoing what Brian Gottschall said and many others, please, when you get the call, please be part of the contact tracing effort. The sooner we get compliance, the sooner we get people safe and the vaccines out distributed in mass quantities, the sooner we can all get back to normal lives. Thank you.
Thank you very much. And thank you, Brian Gottschall, for that very detailed update on the COVID-19 report for Berks County, Pennsylvania, and to a degree for the country. I want to note that since our last commissioners meeting, we did have 2 executive sessions, one on December 23rd dealing with litigation and personnel, and one on January 6th dealing with litigation, contract negotiations, and personnel. Are there any additions or corrections for the December 15th, 2020 operation meeting minutes, December 17th commissioner meeting minutes, and January 5th operation meeting minutes? Hearing none, the minutes will stand approved as presented. Mary, is there any public comment on specific agenda items?
There is not.
Thank you.
You're welcome.
Going into the agenda, item 1, authorizing under that budget department, adopt a resolution authorizing 2020 budget transfers in the amount of $584,399, 2020 appropriations in the amount of $775,984, and 2021 appropriations in the amount of $527,565 per listing dated January the 4th of 2021. We have several items listed under Human Resources. Item 1, authorize the appointment of Pamela Seaman to Mental Health Developmental Disabilities Administrator in MHDD. Item 2, authorize the appointment of Laura Kemp, Victim Advocate, District Attorney's Office. Item 3, authorize the appointment of Alex Amoroso to Assistant Public Defender in the Public Defender's Office. Item 4, authorize the promotion of Maureen Tice from Payroll Analyst, Human Resources to the Department Manager of Customer Support Services in Facilities and Operations. Item 5, authorize the promotion of Patrick Manley from Certified Legal Intern to Assistant Public Defender 1 in the Public Defender's Office. Item 6, authorize the promotion of Kim Montone from Assistant Public Defender 3 to Assistant Public Defender 4 in the Public Defender's Office. And 7, authorize the transfer of Shelby Rarick from Office Support 3 in the Clerk of Courts to Judicial Coordinator in Court Administration. Item B, adopt a resolution authorizing the following appointments to the County of Berks Alternative Dispute Resolution Panel pursuant to the agreement dated November the 16th of 2009 between the County of Berks and the Department of Public Welfare. They are Faye Fisher, Robert Orzechowski, and Beth Ann Shardle, each for a 1-year term ending January of 2022. Adopt a resolution ratifying, confirming, and approving the chair to execute the 2021 stop loss insurance proposal plan renewal with Nationwide Stop Loss and any and all documents required to complete the application process concerning the Berks County Employee Health Care Insurance Program. Adopt a resolution ratifying, confirming, and approving the chair execution of the Capital Blue Stop Loss reporting form effective January 1 of 2021. Adopt a resolution authorizing the chair to execute the client requirements document for the CVS Health Prescription Program administered by CVS Caremark to add insulin pumps and diabetic supplies to the plan. We have one item listed under purchasing. Adopt a resolution authorizing the award and the Director of Contracts and Procurements to execute 2 contracts for a 2.5-year term as a result of the request for proposal for home delivered meals services as follows. Berks Encore out of Reading, PA, a not to exceed $432,500, and Boyertown Area Multi-Services, Inc. out of Boyertown, PA, not to exceed $101,317.33. We have one item under Commissioner Barnhart. Adopt a resolution authorizing the reappointment of Robert Williams, Reading, PA, to the Council on Chemical Abuse Board of Directors for a 3-year term ending February 1st of 2024. We have one item listed under myself. Adopt a resolution authorizing the appointment of Mary Ellen Wells, Wyomissing, PA, to the Berks County Public Library Board of Directors for a 3-year term expiring December 31st of 2023. We have several items listed under the commissioners. Item A, adopt a resolution ratifying, confirming, and approving Christy Kennedy, Deputy Administrator at the Berksheim Nursing and Rehabilitation, as the authorized signatory on Act 24 reporting on behalf of the Berksheim. Item B, adopt a resolution authorizing Nicole Blanding, Berks County Tax Claim Bureau Director, to execute the settlement agreement between Frank T. Pirano, doing business as GSP Management Company, and Pleasant Hills Management LLC, and the Berks County Tax Claim Bureau, settling and resolving any and all claims in a civil action. Item C, adopt a resolution ratifying, confirming, and approving Brian Gottschall, Director of Berks County Department of Emergency Services, execution of a change order to the Vista 911 Communications and Service Agreement to include call detail records to the Vesta system in an amount of $13,382. Item D, adopt a resolution ratifying, confirming, and approving Shelley O'Neill, Project Manager, Information Systems, execution of a change order in the amount of $13,500 for monthly patch testing support for the HRMS payroll project. Item E, adopt a resolution authorizing Shelley O'Neill, Project Manager, Information Systems, to execute a change order to the AST Corporation contract in the amount of $60,600 to provide for additional post-production support coverage for additional payroll cycles, including 1 full retiree and 1 full tax collector payroll cycle. Item F, adopt a resolution authorizing the chair to execute and submit the U.S. Department of the Treasury Emergency Rental Assistance Agreement and any and all required documents to receive the funds, and further authorizes the Berks County Redevelopment Authority to administer the funds on behalf of the County of Berks. Item 2, a motion authorizing execution of contract agreements amendments as furnished by the contract coordinator is set forth on the attached listing dated January the 5th of 2021. There are a total of 22 contracts. There are 2 with CareerLink, 7 with Children and Youth Services, 1 with the Commissioners, 2 with the jail, 1 with the library, 8 with mental health and developmental disabilities, and 1 with the public defender. And then item 3, a motion to ratify and confirm payments is set forth on the Controller's Office voucher listing dated December the 22nd of 2020, December 29th of 2020, and January 5th of 2021, and the payment of electronic transfers and employee payroll.
I'll motion to approve the agenda as presented.
Second.
The motion has been made and seconded. Is there any discussion? Hearing none. All those in favor signify by saying aye. Aye. Opposed? The motion is carried. I do want to note that our IS department has notified us that there apparently is a problem for people joining the Microsoft Teams live event. We apologize for that issue. Hopefully that will get resolved. And again, that's all we can do. We're aware of it. IS is working on it at this time. With that, we'll continue with our agenda, and I will recognize our Berks County Treasurer, Mr. Dennis Adams.
Good morning.
Good morning.
Let's all pray that 2021 is a better year all the way around on all aspects. So we had an opening budget today of $165,701,459.19. Balance to clear of $4,966,892.57, with a balance of $160,734,566.62.
Thank you very much, Dennis. We'll move now to our County Controller, Sandy Graffius, with the Controller's Report.
We have some catching up to do. So we'll start with December 24th, with the December 24th disbursements. We had total cash disbursements of $10,692,963. On December 31st, we had $3,744,855.59. And for today's report, we had a payroll of $4,406,438.15 for total disbursements of, I have to catch this here, $10,664,942.47.
Thank you very much, Sandy. And at this time, I'll recognize our Chief Administrative Officer, Mr. Ron Seaman.
Thank you, Commissioner. I want to first of all start by thanking all 3 of you for the timely comments you made at the beginning of the meeting. I wholeheartedly agree with them. And first of all, as an employee of the County of Berks, and secondly, as a citizen of this country, I'm most appreciative that we have a Board of Commissioners that takes that kind of a stand. Second of all, in the interest of complete disclosure and transparency, I again, since she is a direct report of mine, want to indicate that Pamela Seaman, in their appointment to the MHDD administrator, is not by blood or marriage related to me. So that's all I have. Thank you.
Thank you very much, and thank you for that clarification. We'll now move to commissioner reports, and we'll start with our Vice Chair, Commissioner Kevin Barnhart.
Thank you, Commissioner Leinbach, and everyone who has joined us this morning. I too apologize for the lack of being able to see the comments. Maybe we can get that rectified before this is over. I too want to thank or congratulate Pamela Seaman in her ascension to the Director of MHDD. That's a wonderful opportunity for her and a wonderful thing for the county to have somebody of her wealth of knowledge and experience to head up that department. Also, under the contracts, I just want to make a note. We do sometimes gloss over the contracts, but the one that's really important to me is Cook County Wellness. The board was notified of the extensive work being done by Carolyn and her senior staff at Cook County Wellness, notwithstanding all the efforts by the contact tracers who are diligently working the phones. But we have, through this contract amendment, upped their percentage for their overhead costs that they have expended tremendous amount of time working with the Department of Health, working with our health advisory panel, and just communicating probably every hour or so with Brian Gottschall, keeping updated back and forth. So it's a great line of communication, and the hours they put in really need to be recognized and compensated for. So thank you, Commissioner Leinbach. That's all I have at this point.
This time I'll recognize Commissioner Michael Rivera.
Yes, thank you, Commissioner Leinbach. Just a few items. I also like to congratulate Pam. Looking forward to working with her in these in the future. So congratulations, Pam. Also, I want to take a moment here to recognize a group that usually isn't recognized, and it's the facilities and custodial staff at the county. With COVID going on, they've had extra work put on them. A lot of additional things that they've had to do, and they've been doing a great job keeping the county property clean and safe from COVID. So I just wanted to take a moment to thank the facilities and custodial staff for all the work that they do. I know sometimes they're overlooked because their job is mostly in the background, something that we don't really, we see it, but it's not something that we sometimes take time to stop and notice. I want to thank them for the work that they're doing. Also, on the rental assistance program, the CDC eviction moratorium was extended till January the 31st. So it was initially December 31st, now it's extended till January the 31st. If you need rental assistance or you're a landlord and have a tenant that needs rental assistance, you can call the Coalition to End Homelessness at 610-372-7222, or if you live in the city of Reading, you can call the Human Relations Commission at 610-655-6141. They do ask that you be patient. They're doing their best to get back to people. With the city being closed, there's limited staff working out of the offices, so they are taking a little bit longer, but please feel free to reach out to them. Also, on December the 27th, with the latest COVID-19 relief bill, there was $900 billion in the $900 billion relief package. There was money included for housing provisions, for rental assistance in the amount of $25 billion. It's estimated that of that Pennsylvania will receive $852 million to help with critical rental assistance to tenants and landlords. This money will be going to those municipal entities with 200,000 residents or more. So Berks County will be getting money. We don't know how much it will be yet, so we're waiting on that. But as you did see today, we did vote on having the redevelopment authority handle that and work through that process once the money gets here and get all the paperwork that needs to be done yet. One of the benefits so far that we see of this money, which we're not completely sure yet, but it's that it should be a little bit more flexible in who can use it and how it can be used, but we still don't have any of the information on that. We're expecting to get that within the next week or two. So again, if you do know of anyone, if you're a landlord or a tenant and they need rental assistance, please reach out. If they don't qualify for one of the programs now, there will be this new program which we're hoping will be in place before the eviction moratorium ends we're not sure. We can't determine, how to work time-wise, but we're hoping that it will be soon to be able to keep people in their properties and not have to have them be rehoused or allow these evictions, which will cause more issues than we currently have in the economy. So if you have any questions, please stay tuned. We'll be sharing as more information becomes available. Thank you.
Thank you very much, Commissioners Rivera and Barnhart. I do not have any comments. At this time, I will open the floor to any of our row officers for comments. I'll recognize our County Controller, Sandy Graffius.
I just wanted to add to Commissioner Barnhart's report that this past Monday night at 6:30, I had Cole County Wellness on my controller's TV show. It's on YouTube under BCTV. For those of you that are not quite sure how the whole contract tracing process works, if you want to take a half an hour of your time and watch that show, it'll just clear everything up for you, how the people there are taking care of our folks.
Thank you very much. Any other comments from our row officers? Okay, at this time we'll go to public comment. Mary?
I do not see anything in the Q&A comments section.
Okay, go to the chat. I believe there was some information emailed to you from Facebook.
I don't believe I don't see that.
If you could bear with me just a second, I'll copy them in.
Okay, not a
Commissioner,
problem.
while IT's working to get out in front of that with Mary, maybe we could just take a moment and talk about vaccine in the community.
Absolutely.
Great. Do a little bit of time filling, but also get some important information out. We're obviously getting a lot of questions and inquiries through various forms about how people can access vaccine. And the answer is that at the moment, we don't have those answers. Somewhat by design, both the federal and state systems have defined tiers of individuals with eligibility to receive vaccine in somewhat of a serial process. The intent being that vaccine availability right now is somewhat limited. We hope that production will improve. We hope that the ability to administer it will improve, and then it will become more and more available. But at the moment, we're in what is called Tier 1A, which is really long-term care facility employees and residents and healthcare persons with direct contact with likely COVID positive people and or infectious materials related to COVID positive people. I would ask, well, obviously we don't want to discourage anybody from engaging with their government and trying to get the information that they think is important. I would ask that folks do just take a step back. Calling this office, calling other county government offices, calling the hospitals, even to some extent calling DOH, isn't going to make this work any more quickly. Believe me that the moment that DOH opens up the opportunity for vaccine to be received by other groups of people, we will do everything that we can to publicize that and get that out into the community. I would be shocked if people would miss it because it, of course, is going to be seen as very important and picked up by all the news sources, talked about in public meetings like this one. So please be patient. We want to get as much vaccine out into the community as we possibly can in Berks County and everywhere else. But at the moment, given what is available, the focus is on those healthcare providers, and even those programs are still being developed. Penn State St. Joe's is going to be making an announcement today. I have actually seen that announcement late last night, but I believe it's going to be coming out publicly today about how healthcare providers who are not affiliated with the hospital systems will be able to go about accessing that. Our local federal healthcare center has already begun this process with our EMS workers, and Tower Health is right behind in getting their program deployed out into the community. So please be patient, sit tight, and stay tuned for news about that. And hopefully I filled the gap we needed to fill there.
Yes, we'll now recognize Mary Buer, my executive assistant, if you could share the comments. You might be muted, Mary.
No, I'm trying to figure out who is actually the person posting. So I'm
Christopher
looking-
Ellis is the first one.
Chris Ellis.
Yes, from Reading.
Commissioners Leinbach and Rivera, both of you have attended President Trump's rallies. Both of you have publicly supported him and his administration. Yesterday, there was an insurrection at the Capitol in DC by those flying the Confederate flag and the flag of Trump. They sent our Congress into hiding to try to deny President-elect Joe Biden the presidency. They have sowed doubt on our elections right here in Berks County. Your own Berks Republican Party has done this. The Berks Patriots, which Mr. Leinbach donates to, sent buses down to the entire affair. Will you publicly condemn the Berks Patriots, your own party, and disavow President Trump for his attempts to overturn our free and fair elections? Remember that silence is compliance. Crystal Kowalski, why I'm missing. Good morning, commissioners. In response to varied injustices displayed by our local criminal justice system over the years, I have often called for the formation of a Citizens Oversight Board. I have recently concluded that we are not yet worthy of one. Given how obvious the existence of systemic racism is locally and nationally, it would be unconscionable to ask people oppressed by our system to explain to our system just how they are being oppressed. If you or anyone ever doubts or cares to dispute that this country is rife with systemic racism, I would direct your attention to yesterday afternoon's display in Washington, D.C. Please note the police response to hundreds of heavily armed white men invading our Capitol building. Contrast that with the response to peaceful Black Lives Matters protests in the same city. Understand that the onus is on us as a community and those in positions of power to finally realize that there is not equal justice for all in this country or in this county or in this country. It does not exist. It could not have been any more clearly demonstrated. If we care to change that, we have a lot of work to do before we dare to ask the communities impacted by our racism to help educate us. Thank you, Crystal Kowalski. And that is the last of the comments.
There's one more. I'm going to ask Jess Blauser to read, if you don't mind. Jess Royer from Spring Township. And again, folks, I apologize for the technical difficulties today. That's why we're doing what we can to make sure we are compensating for that.
Okay, I'm going to start with Jane Palmer, why I'm missing.
Okay.
She added her municipality a little late after her comment, but Jane Palmer, why I'm missing. Yesterday, we learned the sad news that Queen City Restaurant was closing its doors after 30 years in business. Restaurants in Montgomery County are getting cash grants to help stay afloat because their commissioners applied for and received this money. Why didn't you do the same, and what are you doing to help struggling small businesses in Berks County? And Jess Royer, Spring Township. Good morning, commissioners. Thank you to DES Director Gottschall for driving home the importance of simple lifestyle changes that literally save lives and for countering some of the arguments that we hear regarding COVID-19 and the seasonal flu, and also COVID-19 deaths and expected overall deaths. We can see those same spurious arguments posted by dining establishments who proudly flouted Governor Wolf's ban on indoor dining, thus far without any legal repercussions. The only negative to come from restaurants who think they should somehow be exempt from the public health decision-making process are those individuals who contracted COVID-19 while eating at some of those establishments. One argument we've heard against the establishment of a county health department is that such a department would be forced to regulate such events as bake sales held at churches and community groups. If that's true, surely such a department would also be able to enforce regulations regarding the mitigation of a deadly virus. That being said, the businesses who are losing revenue due to these public health restrictions should absolutely be able to access financial assistance to help get through periods of shutdown, which the county can help facilitate. We're getting closer to widespread availability of a vaccine, but we have a ways to go until we can return to our normal activities.
Okay.
And it looks like that was the last comment on Facebook.
Okay, we will close public comment at this time. I don't know, I posted a note here to Pam Shupp or possibly someone else. I'm a little taken back by Jane Palmer's comment. Why didn't we apply for the CARES money and distribute it? To be professional about it, we did, and we've publicized it widely. We've had multiple public meetings talking about it. We've publicized the list, including restaurants that have received the money in the same fashion that others have. I don't know if any of my colleagues want to deal with the specifics. Anyone want to jump in? But I mean, it's kind of ludicrous to suggest why didn't we when we have, and we have been very, very public about it and very transparent about the process.
Every step we took was publicly documented at budget ops meetings, at these meetings, in all media outlets in Berks County, on our Facebook page. The dashboard is on our county website to show where the money has been allocated to. So that's the first I heard that we weren't doing our job. So enough said for me.
Yep.
Yeah, just some general numbers, and the details are on the dashboard, but there were a little under 500 businesses that were helped out. There was over $11 million that was put out in grants for the small businesses from the CARES Act money. There was also money through the CDBG, which was through the Redevelopment Authority, in conjunction with Neighborhood Housing Services, and that was about another $500,000 that was put out there as well for county businesses earlier on. And also, apart from that, the city of Reading, from their CDBG money, put out, I believe it was around $1 million in grants for small businesses as well. So in total, you're looking at around $13–14 million in grants that went out to over, I would say probably around 600 to 700 small businesses. But the one specifically for the CARES Act grant is up on the dashboard, and the information can be seen there. And this is something I've been talking about in the commissioners' meetings, I think probably for the last 3 months at least.
Yep. Probably longer than that, because we've been working on the CARES Act money, really led by Commissioner Barnhart on the overall, and then on the small business side, Commissioner Rivera, since late spring, shortly after the CARES Act money was authorized. Stephanie Weaver would like to comment on this as well. Stephanie is our Public Relations Officer. Go ahead, Stephanie.
Sure. I was just going to remind everyone that we do have the dashboard, as the commissioner said. We have the grant recipients, the full list for the Berks County CARES grant program. That would have been the nonprofits that were in public health, municipalities, nonprofits, and educational institutions. Those full lists of grant recipients are on the dashboard now. I was just finalizing the list for the New Start grant program for small businesses this morning. So that is going to be posted hopefully today yet, along with some graphics, charts and stuff. The numbers we have for that finalized list for the small business grant program is $11,225,000 for 473 businesses. Of those businesses, 85 were restaurants, or there were a couple caterers in that as well, that group, and they received more than 2.4 million in grants through this program. So obviously we are trying to do as much as we can. Also, every small business that applied and was found to be eligible with eligible expenses was awarded a grant. The commissioners approved for up to 12 million. Like I said, we did 11.2 million for what all was actually eligible for those that applied.
And I happen to know that Queen City applied because I talked to El Sayed El Merzuki about that because I was concerned several months ago about Queen City Restaurant and how important El Sayed has been to this community. He's a good man, good family, and obviously we hate to see that go. And I'm going to close with this. Once again, Jane, just note, you're one of the most consistent attenders at our commissioners' meetings. So I know you've heard about the money before, and I'm a little disappointed that you would put that information out there and make a claim that the county isn't doing anything, because I know that you know the county has been very, very active and involved in applying. We didn't have to apply for the money. The money was granted via the CARES Act, and the work, not just I did, my colleagues, Commissioner Barnhart and Commissioner Rivera especially, but their support teams, Pam Shupp from day one jumped into this, has been very involved. Our partners like Community First Fund going through the process. We talked about this so many times, how we made sure there was no politics. These applications didn't come to the commissioners. They went to committees on the nonprofit side. They went to the Community First Fund on the for-profit, the New Start program side. I'm proud of what Berks County has done and the responsible way that we've processed the funding. So it's frustrating when these kinds of things are thrown out there, and we know that we've been very, very clear about it. Hopefully this clarity will put any questions to rest. Any other comments?
Motion to adjourn.
Second.
The meeting stands adjourned.